I'm Sharrie Harlin, and welcome to Reid Beside You. Today we have Dr. Amber Wolsiefer with Reid ENT, and welcome.
Hi, thank you. Thanks for having me.
And Amber, I know, Dr. Wolsiefer, I know that you're new to our area, and also we always like to find out how our physicians come and find out about our Reid Health. So what brought you to Reid Health?
I actually was a practicing audiologist in Indianapolis and just looking to expand my scope and take the practice of audiology a little further. And Reid presented an option that I just couldn't pass up. So here I am.
Well, welcome to our community.
Thank you.
And what is audiology, and what is an audiologist?
Perfect question. So audiology is the field that focuses on diagnosing and treating hearing and balance disorders. Audiologists are typically, at this point, doctoral level providers, but the field's been around long enough that we have some providers that began practicing before the doctorate was available. So there's some master's level audiologists and some doctorate level audiologists.
Okay. And how does a person know that they need to visit an audiologist or have a hearing test?
So I think probably the most common reason that we get for people recognizing the need for a hearing test is that people indicate that they can't understand what someone is saying. So they'll say, well, I hear fine, but I don't understand what they're saying. It's not clear. That starts to happen pretty early into older adulthood. Usually by age 60, we start to feel like that's happening. Mm-hmm. Most people delay the process of having their hearing tested for a good 7 to 10 years.
Wow.
Yeah, it's a pretty substantial amount of time. So big form of denial there that I think is normal for all of us to have.
So what does one do if they suspect the hearing loss, and what's a typical appointment look like so that they don't wait for 7 years?
So whether they've waited or not, when that patient gets to our office, we do a comprehensive diagnostic hearing test on them. It includes testing in the booth, the traditional testing when you say, raise your hand when you hear the beep, that kind of thing.
So it kind of takes us all back to our elementary school?
Absolutely.
Okay.
Absolutely. It hasn't changed a bit. We also test speech recognition. So we'll read a list of words. How well can you as a patient hear if I make that list very, very soft? Mm-hmm. And also, how well can you understand speech if I present it at a loud enough level for you that I know you're hearing? Are you able to interpret what I'm saying well? So there's kind of a lot that goes into that exam, but it gives us an idea of how loud we need to make sound and how clearly your nervous system is capable of articulating that information. And
I know that with hearing aids, they're not stock items per se. So
correct.
During the appointment,
yeah,
how do you determine what type of hearing aid a person would use?
So hearing aids are quite complex. Hearing loss is quite complex, and your hearing test is kind of like your prescription, similar to when you get glasses. You get your vision checked, and then they use that assessment to order your lenses. Hearing aids, you can pick the style, whether it goes over your ear or in your ear. That's kind of like your frames. But to get the lenses put in, you need to have an audiologist actually do some testing according to the prescription, your audiogram, and make sure that the two match up.
Great. And how many appointments does that normally, can a person
from start
decide?
To finish?
Yes.
So the hearing test obviously being one, then we have a separate appointment where we sit down and discuss amplification options. Not all patients need hearing aids. There are other options out on the market that aren't hearing aids that can help. So we talk about that. We talk about the pros and the cons. Of course, we go over pricing and the patient's lifestyle. What do you need out of a hearing aid? Not everybody has the same type of needs. So that's its own appointment. And then, of course, the hearing aid fitting is its own entity. And then beyond that, we kind of cater to the patient needs according to how many other appointments we would need.
So another thing is, a great thing that we're seeing is when we hear audiology, we see ENT. Mm-hmm. Mm-hmm. And you are in a brand new building.
Absolutely. It's fabulous.
how's that going for you?
So it's wonderful. So audiology and ENT actually work very, very closely together, mostly for people who have medical issues in the ear that cause or can cause a hearing loss. So ENT might say there's some concern for middle ear problems. Fluid in the middle ear is pretty common. Audiology will do a hearing test and say, yes, the fluid is causing X amount of hearing loss, and then the physician can use that information to kind of determine a treatment plan for that patient. So we have the building is split into kind of two sections, one for the ENT side and then audiology and actually allergy are on the other side. And we just are running back and forth all day long helping each other out. So it's lovely.
And for our
really
viewers,
nice.
just to make sure that they're aware that the ENT is the beautiful new building that is on the site of the former pediatric center, and you'll be able to see the two entrances.
Yep.
And the I came to visit the building, and so I'd been to the former ENT, so it seems like there's a lot more room.
There is a lot more room. There is. So it's actually been really nice at helping us follow best practice guidelines for the treatment of our patients. We just have the space to have the equipment that we've needed all along, and we've kind of been getting by as we've had to in the past, but now we don't have to. We have a slew of new equipment, all kinds of space, so we're able to really expand our scope. It's been really, really nice.
What's probably the most interesting piece of new equipment that we've been able to add?
Oh, so our balance lab, so what a lot of people probably don't know, audiology does a lot more than hearing aids. We have a balance function testing that we do, so patients who have dizziness, and they've had some pretty neat technology come out to kind of expand our capabilities with what we can test there. Before we had kind of a smaller room and we didn't have the space to have all of the equipment that we needed, so now we were able to just purchase some new equipment there, so that's been really nice. And I also have been doing infant hearing screenings and diagnostic evals on infants who fail their hearing screening at birth. So we have that equipment now and are doing a lot of those.
So I know that we were saying have hearing loss in more of an elderly population. Have you seen more? I know with different technology, are you seeing hearing loss in younger people?
Absolutely. So I actually have a special interest in pediatrics, so I see most of the kids that come through, and there's a good probably 40% of my patients are pediatric patients, and of those there's a good 10 to 15% with documented hearing loss. Hearing loss has lots of forms, but you can have congenital hearing loss. You can also have hearing loss that you develop at age 3 or 10 or anywhere along that. You can have genetic components that cause that, any of that.
And with the technology, a lot of times we see people that are blasting their iPods or their music. So have you had any? Are we seeing that with a younger population?
We are. There's a lot of noise-induced hearing loss. The scary thing about noise-related hearing loss is that the hearing loss occurs at a very young age, but you often don't see the damage show up until about 10 to 15 years later. Wow. So we're not going to see this now, but it's early adults that we're seeing damage that was done as a young adolescent.
So with the addition of the new space, and you are seeing new patients?
Absolutely. Currently, we actually just hired a new audiologist. This is her first week, so we're expanding pretty rapidly, but definitely taking on new patients, and we keep pretty busy there.
And if I wanted to get an appointment with yourself.
So the main switchboard number is 765-966-1600, and you can just call that number and request an audiology visit. It will depend on whether you need a physician visit also or just an audiology visit, but the switchboard operator should be able to help patients figure out which one of those categories they belong to.
Right, so they can answer the various questions.
Yep. Absolutely.
And do they need a referral to see you?
It depends on their insurance, so that's a loaded question, but most patients do need a referral. It's pretty uncommon that we don't need a referral, but occasionally a patient will come through that does not require one. So they can get that from their primary care physician, or if they have to see an ear, nose, and throat physician as well, they can provide that.
So it's like, so I didn't just wake up one morning and say, I'm going to the audiologist.
Typically not.
So so actually as the process that you had explained earlier, that makes it a lot easier, and we can follow through from there.
Absolutely.
And if another thing I wanted to ask, if they possibly hadn't gone before, or they they woke up, as we said previously, and said, I think I need hearing, or I'm wondering, do you get a lot of referrals from family members, or family members bring people to you?
Absolutely. So most hearing loss is not first noticed by the patient that's going through the hearing loss. If you think about it, it makes sense. If a patient is not hearing something, they don't know that they're not hearing.
Right.
But a spouse or a sibling or a child can say, Mom, you did not hear what I said. If someone says, hey, did you hear about that crash? And the patient says, yeah, I took the trash out yesterday. There's obviously a mistake there,
Right.
but the patient is not noticing it. It's the family members that pick up on it. So ultimately, though, it's the patient that has to be in the office, which is where that 7 to 10 year denial phase comes in. So
It's helpful that family members
absolutely.
or
And we
caregivers
encourage
seem to
family
be-
members to come. A lot of times these visits are difficult because the patient has hearing loss. So all of the conversation that goes on about their hearing loss is while they aren't hearing adequately.
Okay.
So it's always nice to have even a friend of the family, a child, a spouse, a parent, anybody that you can bring with just to kind of help absorb all of the information. It's a lot to take on.
So, well, we want to thank you.
Well, thank you.
For being on the show today. And that was very informative. I learned a lot.
Well, good. I'm glad.
Not just going through the office.
glad.
And we hope our viewers, and once again, what's the number that they could call?
765-966-1600.
Okay. And thank you today to Dr. Amber Wolsiefer.
Thank you so much.
Thank you. And thanks for joining us for the second half of our show. And we have Melanie Harrison, nurse practitioner and business line manager with Reid Urgent Care and Reid Ready Care. And thanks for joining us.
Thank you for having me, Sharrie.
And Melanie, I know that you actually live in our community, as well as have been with Reid for a while. And how did you decide to go into the medical field?
I've just wanted to be a nurse for as long as I can remember. My grandma was a nurse, and so I started working at Reid when I graduated from nursing school. I started out in the emergency room, and now I've moved over to the urgent cares.
So you like to keep things quick, be in the emergency room to
Yes,
urgent care.
yes,
So, great. And speaking of urgent care, you have a beautiful new building.
Yes, we do. Yes.
So I know we have several locations, but first we're going to speak on the brand new building on Chester Boulevard.
Yes, so we just moved there about 2 months ago. We have a dental clinic that's in the basement of the urgent care. The dentists come Tuesdays and Thursdays to the dental care. And then we have upstairs is the urgent care area. We have a centralized nursing station now, and the providers and the nurse practitioners and doctors are all together in the same area, so the wait times have drastically decreased since we've moved to the new location. And we actually have a new doctor that just started yesterday, and we have 4 new nurse practitioners that are starting in the next couple of months, so that's going to really help with our wait times there too.
Okay. And where are your other urgent care?
So we have the Ready Care inside Meyer in Richmond, and then we have the Whitewater Valley Urgent Care in Connorsville, and then we have the Reid Urgent Care, Eaton Urgent Care in Eaton, Ohio.
Okay. And all of those, do they have some of the same hours? Or are they different?
They do differ just a little bit, just depending on the community's needs.
Okay.
So, but we are open in evenings and weekends at all of those locations.
And one of the things I always like when we're out in the community trying to explain to people, when do you need to go to a primary care or a Reid Ready Care? And do you still need to go see your primary care provider?
Yes, absolutely. So the
Okay.
urgent cares do not replace the primary care provider. We manage acute illnesses and injuries, not the chronic conditions or chronic illnesses or injuries.
And can you explain that to our viewers?
Yes, so a chronic condition is something that you have all the time, like diabetes, blood pressure problems, high cholesterol. Those are the things you would want to go see your primary care doctor for, and they are the ones that will refill all your medications for those conditions. And then acute illnesses like sore throat, cough, congestion, those are the one you'll want to go to the urgent care or the ready care.
Okay. And also, so for instance, if I need a wellness check, will I see my primary care or will I come to the urgent care?
You would go to your primary care for the wellness check.
Okay.
And all your immunizations.
And with the new urgent care, as you were explaining what they have, I know I've worked a lot with the dental clinic. And when we first created dental clinic, there was such a demand. But from my understanding, there's still a demand.
Yes, there is still a demand. We were doing it just once a month, or just one day a week, so 4 times a month, and then we had such a demand that we are now doing it twice a week.
Okay.
So,
And we'll make sure that we get information that people can call the dental clinic when they come. And one of the things, the design of the urgent care, I found pretty interesting when you were saying earlier with that you can really, the camaraderie and also it's very patient care centered.
yes, it is. Yes. So the design, the new urgent care was designed by physicians, nurse practitioners, engineers, and architects, and as well as administration. And so all the input of all the clinical mind kind of helped that, I think. So it's been very, very nice.
And I know we were saying the shorter wait times, and we had a very temperatures, we didn't have the snowfall over the winter, but we had flu in our area. So,
We did have the
and
flu.
I'm sure that there were days I would drive past and there were lots of cars at the urgent care. So I believe a lot of people visited the urgent care who have
Yes.
never been there previously with this flu that we had this last season. So.
Yes, so we moved February 9th, which was right in the middle of flu season. And so the first day there, we saw, I think, 70 to 75 patients.
Wow.
So, yeah, when we have that kind of volume, the wait times are a little longer, but typically it's not that bad there.
Yes. So I just wanted to bring that up, that
Yeah.
people know it's normally not that bad. It's
Yes.
just we had a really bad flu season. So, and with the urgent care just moving, I also hear there's some new upcoming changes to Reid Ready Care that's in Meyer.
Yes.
Can you tell us about that?
Yes, very exciting. So we just closed the doors on Sunday night, and we are going to be closed for 5 weeks at the Ready Care. We're going to reopen on May 15th, and with the reopening of that, we are going to have 3 exam rooms because we only have 1 right now. And we're also going to have additional staffing there and a little bit bigger of a waiting room. So we should have a little more room for everybody, and we are hoping with the additional staff and the additional rooms that we'll be able to decrease those wait times there as well.
And it's been such a benefit to the community that I remember when we first started, people were saying, do I want to go see my doctor where I get my groceries? And then it became so popular now that we were expanding. And that's been a real benefit. Also for students from Ivy Tech, IU East, that can just walk across the street. So I know that's been a really a good plus. And so people that with the Reid Ready Care, with that being closed, where would you refer the people to urgent care or
Yes,
to
yes, you should go to
currently?
any of the urgent cares or the Reid Health Now.
Okay. And real quick, could you tell me about the Reid Health Now?
Yes, so that's basically telemedicine, and you just need a smartphone or a computer, and you can just download the app and you can get on your phone or your computer and see a doctor right there from your phone or your computer from your house or wherever, from work, wherever you're at.
So you're saying that I can communicate with a physician, and that's very helpful if I had something and I couldn't walk one day. and that way I could talk to the physician, and then they could diagnose me, and then I had the prescription, and I never had to leave the house. So that's a big
Very
benefit. The another thing is, so the Reid Ready Care that's inside Meyer, how is that different than the urgent cares?
So the Ready Care, it is still an urgent care, but it only sees very low acuity conditions.
Okay.
And we'll have a service flyer that you can refer to see that. And we see just very minor things. The Ready Care does some testing for, we can do the flu test, strep test, mono, and we can test for urinary tract infections there. Any kind of blood work or x-rays has to be done at an urgent care though.
Okay. And another thing, do you do physicals at urgent care, or?
We do sports physicals and college physicals, some work physicals. Actually, on May 15th, when Ready Care reopens, we're going to be offering $10 sports physicals from May 15th to June 30th. And actually, that will also be at all the other urgent cares as well.
Okay. So that's great for people that are doing sports through the summer and getting ready for fall sports.
Have it already done before.
So
it starts.
that's great. And another thing is, I want to get back in. Often we have like children that, especially during this flu season, we had a lot of kids coming in. So because you're close to the Peds Center, do you have any overlap? Do people, sometimes you just have to, some of the patients come from the Peds Center to the urgent care? Or back and forth?
Yes, they do. The urgent care, they have to be 4 months at the urgent care to be seen, and then at the Ready Care, they have to be 7 months to be seen.
Okay.
7 months old.
So there is an age
limit, yes.
And being age appropriate. And the other thing is, when often somebody says, I've gone to urgent care, and then they sent me to the ED. That's always a big thing, because we'd prefer you come to the urgent care, because the going to the emergency department, immediately that's almost a $500 extra, and then the test. So
Yes, so a lot of people do come to the urgent care because of that reason, and then just depending on the symptoms and the situation and the medical history of that person, we have to decide if we send the patient to the ER or not.
okay. Because, but the biggest thing we want, our first choice is to make sure that you can go to urgent care.
Yes, and then we will stabilize the patient if we have to send them to the ER.
Okay. What stabilize me?
Stabilize means
To our viewers. I know, but to our viewers.
Yes, so it means that if you have, say, trouble breathing, we will give you some oxygen and just try to give you any kind of medication or treatment we can, a breathing treatment, before the ambulance gets there, before we can get you up to the hospital.
And I forgot to ask, how many approximately employees do you have with urgent care and Reid Ready Care?
Between the two buildings, the two locations, we probably have about 30, 35 people
So,
for the one here in Richmond.
No wonder all of our challenges during that major flu season. You had a lot of people working a lot of long hours, and we thank you for that. And so the first things we should remember, that if with non-acute, that you can visit urgent care, you can visit Reid Ready Care when they open again, May 15th.
May 15th.
And I'm sure we're going to have a big grand opening, or
Yes, I'm sure we'll be doing that. Yeah.
so
yeah.
please
yeah.
look out for the all the advertisements and to explain what's going on. And it'll be fun to come visit. And I'm sure we had a lot of compliments, and people will be very excited to see that that it's expanded.
Yes, yes.
So they won't
I
have to
think
stand
people are really-
outside. They weren't standing outside. It was kind of, as people were getting their groceries, they waited along. So, and to conclude, I want to thank you, Melanie, for coming to visit Reid Beside You.
Yeah, you're
and we
welcome.
learned a lot today about Reid Ready Care, and we look forward to their opening, as well as the new Reid Urgent Care. So, and thank you very much.
Thank you.
And thank you, viewers, for joining us. And we'll see you next time, Reid Beside You.